Dr David Oehme here. I'm a neurosurgeon and spine surgeon based in Melbourne, and today we're going to be talking about symptoms of disc herniation. Now, if you're not sure what a disc herniation is, check out my other video on what is a disc herniation. So, symptoms of disc herniation. Well, the first symptom is it may be completely asymptomatic. If we do an MRI of 100 people, we'll probably find that a lot of patients have small disc herniations or disc bulges that aren't causing any symptoms. So just because you've got a disc herniation on an MRI doesn't mean it's necessarily causing you any pain. Now, chances are if you're watching this video, you do have pain. So let's talk about what symptoms happen with a disc herniation. Well, there's really two separate types of symptoms. The first is back pain. Now, whenever someone suffers a disc herniation, most often it causes back pain. Now, the cause of the back pain can be difficult to explain. Sometimes it can come when the disc ruptures, or other times it can be due to spasm of muscles or stretch on ligaments within the spine. Ultimately, most patients with a disc herniation will have some type of back pain. Now, the other important set of symptoms that happen with a disc herniation are symptoms related to nerve compression. Intervertebral discs are very intimately related to nerves around the spine. Now, these nerves within the lower back go to your legs and also to your bowel and your bladder. When these nerves are compressed, they're not happy, and this causes a whole host of symptoms. Now, the most common symptom when a disc presses on a nerve is a term called sciatica. This is pain in the leg related to pressure on a nerve in the back. Now, this is often described as a sharp, shooting, electric-like pain in the leg. And this can cause a lot of pain and disability for patients, and is probably the main reason patients will come and see me with a disc herniation. Other common symptoms that patients describe are numbness or tingling in the legs. Now, nerves coming from the leg carry sensations such as touch, pain. When the nerve is compressed, often it's very common to have numbness or tingling in the distribution of that nerve. These symptoms are typically recoverable, and if you do have pain or pins and needles, you don't need to panic. Other symptoms that happen when a nerve gets compressed, rarely it can cause weakness in the leg. Now, if you do have weakness, this is something that needs to be taken very seriously, and it's important that you go and see your doctor about this. But sometimes this can be just mild weakness in the leg, or other times you may even develop symptoms such as foot drop. This is rare, but should prompt fairly urgent medical assessment. Now, if the nerves going to your bladder or bowel are controlled, this can also cause problems with controlling going to the toilet. This is a syndrome called cauda equina and is also a medical emergency. But for most patients, they'll typically be dealing with back pain, sciatica, and maybe some numbness or tingling in the leg. The benefit for you is most disc herniations are treatable, so it's important not to panic. Now, if you are suffering from back pain or sciatica, a lot of patients will ask, what investigations should I have? Now, commonly patients will have x-rays ordered. X-rays are not helpful in most patients, okay? So it's not really worth getting x-rays performed. You really want to have an MRI scan. So if you're getting pain in the leg and it hasn't been settling, then see your local doctor and arrange for an MRI scan to be performed. This will show if there's a disc herniation or pressure on the nerve. Now, if you're unable to have an MRI scan, if you've got metal in your body somewhere that precludes you from having an MRI scan, then a CT scan will give a lot more information than just a simple X-ray. Certainly, if you do have pain, it's important to see a local doctor and they can organise the investigation for you. But if you can, I'd ask for an MRI scan. For more information on symptoms related to disc herniation, you can check out my website in the link below. It's www.doneurosurgery.com. And if you'd like more information about treatment for disc herniation, please see the other videos on this channel.